Hey there. If you're over 60 and waking up with tingling feet, burning legs, or sciatic pain, your sleeping position might be quietly damaging your nerves every single night. In this video, I'm going to show you the one sleeping position that actually supports nerve repair while you sleep, and why most seniors are unknowingly sleeping the wrong way. Even if you've had neuropathy for years, even if you've tried pillows, stretches, or medications with little relief, this small adjustment could completely change how your body heals overnight. And in just a few minutes, I'll show you exactly how to set it up correctly. Because one tiny mistake can cancel out the entire benefit. I'm Ellis. A few years ago, I started waking up almost every night with numb feet and a burning sensation running down my legs. I thought it was just part of getting older. I tried different mattresses, expensive supplements, even nerve creams. But nothing really changed. Some mornings it felt worse than the night before, especially the sciatic pain. Then I came across research showing that the way I was sleeping was actually compressing the very nerves I was trying to heal. Once I adjusted my sleep posture the right way, the nighttime tingling started easing up, and I finally began waking up feeling rested instead of inflamed. There's a lot of confusing advice out there about neuropathy and sleep. So in this video, I want to show you what actually makes a difference and how to avoid the mistakes I made. All right, now let's break this down clearly and simply. In the next few minutes, I'm going to show you the 3 sleeping positions that quietly worsen nerve damage, the one position that supports circulation and spinal decompression overnight, exactly how to set it up with pillows, how long it takes to see improvement, and 3 simple habits that dramatically speed up nerve repair while you sleep. Because here's the truth most people don't realize. Your nerves don't just hurt, they either get compressed, inflamed, or starved of oxygen. And your sleeping position affects all 3. Let's start with what most seniors are doing wrong. The 3 worst sleeping positions for your nerves. Wrong position. Number 1, flat on your back with legs straight. This one surprises people. Sleeping flat on your back seems neutral, but for many adults over 60, it actually increases pressure on the lower lumbar spine. Here's why. As we age, the discs in the lower spine lose hydration and elasticity. When you lie flat with your legs straight, your lower back often overarches slightly, especially if your mattress is soft. That arch compresses the nerve roots that exit the spine, particularly those connected to the sciatic nerve. You might be wondering, but I thought back sleeping was the healthiest. It can be, if properly supported. But when your knees are unsupported, gravity pulls the pelvis forward, increasing lumbar compression. Now here's where circulation comes in. When spinal nerves are compressed, blood flow through those nerve pathways becomes restricted. Nerves need constant oxygen delivery to repair themselves. Reduced blood flow at night equals reduced repair. And if you already deal with neuropathy, that small nightly compression adds up. Wrong position number 2. Tight fetal position. This one feels comforting, but curling tightly into a ball can do 2 things: twist the pelvis, restrict blood flow through the hips and glutes. Remember something from earlier. Blood return from the legs depends heavily on muscle and vein positioning. When your top leg collapses forward without support, it rotates the pelvis and compresses the sciatic pathway. That means less oxygen reaching the nerve, more inflammation building overnight. Have you ever noticed one leg feels worse than the other when you wake up? That's often pelvic rotation compressing one side more than the other. Wrong position number 3, stomach sleeping. This is the biggest red X. Stomach sleeping forces, lumbar extension overarching, neck rotation, pelvic compression. From a mechanical perspective, this increases direct pressure on the nerve roots. From a circulation perspective, it reduces proper venous return from the lower body. Now here's something interesting from vascular research. Blood returning from the legs must travel upward against gravity. That process depends on muscle pump activity, vein valve function, proper body positioning. When you sleep face down, you increase abdominal pressure, which can restrict that upward return flow. Reduced return flow equals pooling in the lower legs. Pooling leads to swelling, inflammation, oxygen deprivation of small peripheral nerves, and nerves deprived of oxygen don't repair well. The one sleeping position that supports nerve repair. Here it is. The best sleeping position for seniors with neuropathy or sciatica is side sleeping with neutral spine alignment and supported knees. Not curled tightly, not twisted, not flat, neutral. Here's why this works. And this is where the science gets powerful. Mechanically, it reduces nerve compression. When the spine stays aligned, lumbar discs are evenly loaded. Nerve roots experience less pressure. Sciatic tension decreases. A neutral spine means head in line with torso, hips stacked, knees gently bent. That alignment reduces mechanical stress on spinal nerves for 6 to 8 hours straight. That's a long time for decompression. Circulation. It improves oxygen delivery to nerves. Now let's connect this to blood flow. At night, your body naturally shifts into repair mode, but circulation slows slightly because heart rate drops, movement decreases, muscle pumps stop activating. If your body position allows pooling or compression, blood flow becomes even more restricted. Side sleeping with knee support allows unrestricted venous return, reduced abdominal pressure, better microcirculation in lower limbs. Better circulation means more oxygen delivered to nerve tissue, better removal of inflammatory byproducts, more efficient overnight nerve repair. And here's something most people don't know. Peripheral nerves regenerate slowly, about 1 millimeter per day. But they cannot regenerate effectively if inflammation and compression continue nightly. This position helps stop the nightly irritation cycle. How to set it up correctly. This part matters most. Because most people try side sleeping and still do it wrong. Let's build this step by step. Step 1. Put a pillow between your knees. This is non-negotiable. A firm pillow prevents the top leg from collapsing forward. That keeps the pelvis neutral and reduces sciatic tension. If the top knee drops forward, you lose alignment instantly. Step 2. Slight knee bend, not curled. Think relaxed, not fetal. Bending too tightly restricts hip circulation. Keep knees gently bent at about 30 to 45 degrees. Step 3. Neck alignment. Your head pillow should keep your neck level with your spine. If your head tilts up or down, cervical nerves become strained. Full spinal alignment is lost. Step 4. Optional but powerful. Small lumbar support. If you tend to roll backward, place a small pillow behind your lower back. That keeps you from twisting. You might ask, how long until you notice improvement? Now let's set realistic expectations. If nerve irritation is mild, you may notice reduced tingling within a few nights, less stiffness in the morning. If neuropathy is chronic, expect 2 to 4 weeks of consistent positioning before noticeable changes. Remember, you're not instantly repairing nerves. You're removing nightly irritation so the body can finally heal. Healing happens gradually, but steadily. 3 supporting habits that amplify results. Now here's where we use even more of the physiology. Sleeping position helps. but combining it with these 3 habits accelerates nerve repair. Habit number 1, gentle evening the calf activation. Before bed, perform 1 to 2 minutes of seated calf pumps. Why? Your calves are called the second heart. When they contract, they help push blood back up toward the heart. Improving evening circulation reduces pooling overnight. Better circulation equals better oxygen supply during sleep. Habit number 2, keep feet warm. Cold constricts blood vessels. Constricted vessels reduce oxygen delivery to nerves. Wearing breathable socks at night can maintain circulation, reduce nighttime neuropathy symptoms. Habit number 3, avoid heavy late night meals. Digestion increases abdominal pressure. That pressure can reduce venous return from the legs. Heavy meals before bed may worsen pooling and inflammation. Finish eating at least 2 to 3 hours before sleep if possible. If you found this helpful, please like and subscribe for more science-backed tips designed specifically to help seniors stay mobile, independent, and pain-free.